Good morning, everyone. Welcome to the American Enterprise Institute. Thank you all for coming out to discuss this important issue of substance abuse and its effects on our foster care system. This work is part of a continued effort by the scholars here at AEI to more fully understand the issues that most affect struggling Americans and to suggest policies that can alleviate some of these problems. The number of kids in foster care, many of you may know, had actually been largely steady during the 1990s and early 2000s, but it has seen, unfortunately, a spike in recent years. And the reason, at least in part, seems to be drug abuse. As a March report by the U.S. Department of Health and Human Services found, a 10% increase in overdose death rates is correlated with a 4.4% increase in foster care entry rates. The question of how to care for these children is a thorny one that we hope to explore in greater depth this morning. And it is the first of many questions, including how many chances should parents have to get clean before their children are removed permanently? What is the role of medical providers in caring for parents and children and reporting these problems to local authorities? And what approach should the courts take to this? This morning, we are so pleased to welcome Governor Doug Ducey to help us explore this issue. The governor has recently signed legislation that would ensure the court systems move faster, sometimes even to sever parental rights, when infants have been born substance exposed. Governor Ducey is the 23rd governor of Arizona. Before entering public office, he spent his career in the private sector, including serving as CEO of Cold Stone Creamery. So he was already thinking about child welfare before he entered public office. During his first year in office, the governor has led a number of major reform initiatives, including the recently enacted Arizona Opioid Epidemic Act, aimed at fighting the opioid crisis. After the governor speaks, I will ask him a few questions, and then we'll have a brief break before I introduce our distinguished panel. For now, please join me in welcoming Governor Ducey to our stage.
I want to say thank you to Naomi, and it's a pleasure to be here this morning in Washington, D.C. and at AEI. I'm a big fan of the work that you do here. I want to talk about something that I think is one of the most significant public health and safety emergencies our nation is facing and the state of Arizona in a generation. And this is the opioid crisis and the impact that it's having on Arizona families and on our foster care system. And hopefully we'll be able to show how all of these things are linked. The place I want to begin is Arizona's efforts to transform our foster care system and provide our children with loving homes. When I came into office, our Department of Child Safety was being described as the most broken agency in the nation, and it was in dire need of attention for the sake of Arizona's kids. We had 19,000 kids in the care of the state, and I don't need to remind the people here that the state is not a very good parent. We had a backlog of more than 16,000 uninvestigated cases inside our system. So we had a new governor. I thought it was time that we start with a new leadership team at the Department of Child Safety, and we searched out the best third-party contractors to work with us through this backlog. I also, Naomi mentioned Cold Stone Creamery, and that is the business I built, but I was trained at Procter & Gamble, and what I wanted to do is bring those business principles to our state government. And government is not a business, but there are principles in terms of agency heads understanding their mission and what they are paid to do and what their team is there to achieve. Also understanding the metrics that they need to measure so that they can find that success, how they spend the money, and then it's transparent to taxpayers, and then they memorialize what has been done over the past 90 days and what will happen over the next 90 days so that we can gauge, are we going in the right direction, or what types of changes and adjustments do we need to make inside a cabinet meeting. We call that the Arizona Management System, and that's across every agency in the state of Arizona. We've also reviewed every policy inside the agency and reformed what wasn't working. We've implemented these strategies to strengthen families and bring about successful reunification when possible. Many amazing Arizona families have stepped forward to foster and adopt, and there really is no substitute for that. You do need people outside of the government to step forward and say, I can be helpful. We also have community-led efforts like Care Portal that actually puts people in need together with local churches. It's great to write a check to the United Way or to the Bishop's campaign, but there's nothing like people on the ground that want to help folks inside their zip code. So the Care Portal has utilized technology and the faith-based community to help people and to keep people in their homes so children are not removed for neglect. So I think our results speak for themselves in terms of going in the right direction and the dramatic improvements that we're enjoying. In March of this year, out-of-home care population in Arizona dipped below 15,000 and continues to drop every month. Our backlog of 16,000 uninvested cases has been cleared and eliminated in total. Open reports per DCS caseworker have dropped from 145 per case worker to 22. It's very manageable caseload. And our child abuse hotline hold times have gone down from over 12 minutes to 27 seconds. Our results have garnered national attention. That's why I'm here in Washington, D.C., talking to you here at AEI. For his leadership and the extraordinary role that he has played in the safe reduction of kids in foster care and elimination of the backlog, Department of Child Safety Director Greg McKay won a National KC Excellence for Children Award. He also received Child Help's National Voice of Children Award for the amazing work and progress that he's made at the department. And it took several years to begin to head in the right direction. I also want to emphasize that the credit for Arizona's progress goes to the incredible dedicated employees at this state agency and to the foster, adoptive, and kinship families and to community members who put up so much time and energy to focus on this agency. And I also want to say this couldn't have been done without Arizona's faith-based community. To have preachers and pastors from behind the pulpit challenge their congregations to get involved in foster care and adoptive care has made a tremendous difference. So we know that our work will never be done in this category, and we want to see every child in Arizona have the opportunity to be in a safe and loving home. And the work is becoming exceedingly more difficult because of the destructive power of substance abuse in our state and in our country. Last year, we lost 800 Arizonans to opioid abuse and overdoses. In some cases, this has left children without a mom or a dad. And in many cases, opioid use or other substance abuse has led to the removal of children from their families. In fact, a majority of children within our adoption system are there because of an issue related to substance abuse. And sadly, in 2017, DCS received more than 4,200 reports of substance-exposed newborns. This opioid crisis demanded immediate and aggressive action. So in this past legislative session, we called a special session in the first week in January and passed what's been called the most comprehensive and thoughtful legislative package any state has passed to date. It focuses on both prevention and treatment. Our plan provides an additional $10 million for addiction treatment to help uninsured and underinsured people get the treatment they need. It holds bad actors accountable, whether they be doctors, manufacturers, or distributors, and it cracks down and ends pill mills. It also cracks down on forged prescriptions, limits first fills of opioids, which is very important in reducing future addiction, and very importantly, it maintains access to those who rely on these drugs, cancer survivors, burn victims, but our medical community can do a much better job in terms of prescription. This is a model for other states and the nation to follow, and believe it or not, this passed in the state of Arizona. It was introduced on a Monday. We worked on the summer to make sure we had a comprehensive plan, introduced it on a Monday during a legislative session, and on Thursday it passed with unanimous support out of our House and Senate, both Republican and Democrat. So among the many measurable signs of progress we've made so far in this fight is in March and April of this year, we saw a 33% reduction in the number of opioid prescriptions statewide compared to March and April of previous year. Since July of 2017, we've seen a 60% reduction in the number of patients doctor shopping. And since last June, we've seen a 38% increase in the number of people referred to behavioral health treatment from hospitals after an overdose. This is a fight that will remain persistent and deadly, but working together and across the aisle is making a difference, and it's a fight that we just don't get to take a pass on. We've also addressed substance abuse directly within the foster care system. Arizona's implemented something unique called the Substance Exposed Newborn Safe Environment, or SENSE program, which allows children to remain safely in the home while ensuring parents work on their sobriety. In the past, if a parent who gave birth to a baby with illegal substances in their system might have expected to have that child removed immediately and returned after sobriety had been achieved. But we felt this could force parents to choose between their children and getting help. And we didn't want to deter expectant mothers from seeking prenatal care and help after their baby was born. The SENSE program includes intensive in-home services, substance abuse treatment, up to 5 visits a week from service providers, and in-home nurse visits to ensure parents are making progress with sobriety. This started as a pilot program in Maricopa County, our state's largest county with a population well over 4 million, and has expanded since statewide. And it's producing significant results. Data from Maricopa County has shown that 90% of families that have completed the SENSE program had no DCS reports 6 months after the completion of services. So our efforts to help families stay together don't stop with the SENSE program. In 2017, we also passed a law to provide a kinship stipend to aunts, uncles, grandfathers, and grandmothers to help raise their nephew or grandchild. We also lift the cap on TANF benefits so that family members can access these resources for children under their care. We've made some progress fighting the opioid crisis in Arizona and keeping children and families together, but we know these fights are far from over. I want to close by saying thank you to everyone here who works day in and day out on the safety and security of America's children and families. And I want to say thank you once again to have this opportunity to share what we're doing in Arizona and the nation's capital. Thanks for having me.
Thank you so much for that. It was quite a comprehensive list of the things that you've done, and I just wanted to ask you a few questions.
Sure.
Some of these may be too early to see results, but just in terms of the policy. So the first question is about this legislation involving substance-exposed infants in particular. Given that the addiction treatment in our country has a very uneven record of success, what do you think are the prospects in terms of parents who are using, especially when infants are born already exposed? What do you think are the prospects for these parents being able to achieve sobriety, and how are we going to deal with the question of children going in and out of care as their parents may achieve it once and then unfortunately have relapses?
I think the results that we've seen in Arizona have been instructive to this. I mean, this is an incredibly difficult challenge, and it's not just in Arizona, it's across all 50 of our states. What we tried to come at it from the perspective that we wanted to start with the child first and what is in the best interest of the child, and how can we move as effectively and as quickly and with a sense of urgency. When there is an opportunity, we want to give the mothers every chance possible to achieve sobriety. But when we aren't seeing the signs of progress, we need to put that child in a loving home and find permanency and safety as soon as possible. It's a judgment call on behalf of the social workers and the legal entities inside the state. But what we didn't have when I came into office 3.5 years ago were options for these kids. These kids were actually living at the state agency. They were staying the night there for days. Today we have foster parents that have stepped up, adoptive parents that have stepped up, and we've got a lot of people and behavioral and mental health providers that are actually working with the mothers. So if we can see signs of progress around sobriety, we're going to have a successful, happy story there. And if we don't, we need to get the child into a home where they'll have love and care.
You mentioned, just how many people from these different agencies are involved in this program. There's a lot of home visitation. There's a lot of checking up on parents. There are a lot of critics on both sides of the aisle today who worry about the over-involvement of government in the lives of family, that children are being taken away without cause, or that parents are sort of remaining under the watchful eye of social services long after it's necessary. Is that something that concerns you, and what where do you come down on that question?
Well, I am very concerned about the overreach of government. But on issues of public health and public safety, I mean, these are the most vulnerable in our society. There are 19,000 children, like I said when I came into office, in the care of the state. You can't talk about looking the other way. I mean, this is idea of protecting the most vulnerable. Now, it's not only the government that can get this done. This is where the challenge went to the faith-based community. That I'm proudly pro-life, but I'm also whole life. And these are children that are born and in our midst. So this idea of we need to find and recruit foster parents, we need to bring in adoptive parents, and then the role of the state and social services in combination with volunteer and outside organizations in terms of providing support to these mothers when there is the opportunity for recovery, I think is something that can be convened and led by the state. But you also need, well, I've mentioned the faith-based community, but other community involvement as to what kind of state we're going to be and what we're going to do with these children in these situations. And if we don't act on these children while they're young, we are going to be dealing with them in public policy in our correction systems later.
Mm-hmm. You mentioned the lowering of caseloads for social workers in your state. A number of states have recently added millions of dollars to their budget in order to expand the workforce in this area. How much of the problem do you think is financial, that we are not devoting enough resources and reducing caseloads so that social workers can pay the right amount of attention to these kids? Well,
resources are, of course, critical in all of these situations, but I think we need to tie the resources to what the intended result is. So when we had such an obvious crisis in the state of Arizona, and it wasn't just the people that were in elective office that were aware of it, so was the press and everyone else. So we were able to show the progress to move 11,000 children in the state of Arizona last year into an adoptive home or a foster home was just a tremendously successful year. Now there's more to do, and there's other kids that have come into the system or come back into the system. So I think resources are always going to be a part of this, but we need to talk about what the results are that we want to achieve. We're never going to completely clear the backlog, or I should say the amount of children. There will always be unfit parents, but we want to make certain that we're putting these children in foster and adoptive homes. And then I think there's other things that we can do in public policy. Right now we're talking about the opioid issue, and I'm sure we'll probably be talking about the success in solving the opioid issue a year or two from now, but there will be an issue beyond that. I mean, I think the discussion that is as important or more important to have is we don't as much have an opioid epidemic in this country as we have an addiction epidemic.
You mentioned the important role that the faith-based community has played in your state in terms of solving the foster care and adoption problem, and the importance of recruiting more families through those churches and faith-based agencies. I was wondering if you could weigh in on this question that the country is facing now A lot of states are now putting pressure on foster care agencies to not discriminate on the basis of sexual orientation in terms of the families that they serve. And some agencies, faith-based agencies, are actually sort of getting out of the foster care business because their consciences do not allow them to serve all families. I was wondering whether this is an issue that you're thinking about, whether you think there should be legislation to preempt these actions, or whether you see some other way forward at this point.
Well, we need more help in the foster care area. We don't want to see anyone leaving in terms of help or support. In Arizona, we've been able to work within the law to avoid some of the situations that have happened in other states. And it is something I've been thinking about. I think we need to have more common sense around this and think of what do we want to do so that we can respect people's constitutional rights and provide options for families and people that want to participate in this system, with the thought process being that our number one priority should be that child and finding a safe, loving home for that child as quickly as possible.
Can you elaborate? You said you were trying to work within Arizona state law to do more on this. What are the specific kind of the context that you're working in there?
Any individual, single or married, can come in Arizona and apply to be an adoptive parent.
So that allows...
To date it has. I mean, there can always be lawsuits and challenges, but today that's been helpful. And Naomi, I appreciate that you said that we've solved this in Arizona. I think we've made dramatic improvements, and the trend shows that what we're doing is working. But I think this is something that you want to remain ever vigilant on. Something I've seen as governor is once you have one of these things that's not on the front page every day or being written about, oftentimes it doesn't get the same attention. And that's why we put the Arizona management system in place so that it's visible to all of our citizens, and there's always core constituencies that care about different agencies with different priorities, so that this can't be hidden. If the trend changes, there can be an immediate discussion as to what's changed and why is the backlog increasing, why are wait times increasing, why are any of the numbers that we're so proud of that have gone so much in the right direction. And those are those business principles that I talked about. Just in terms of metrics, it's actually easier in the private sector. In the private sector, you have to focus on revenue and profit. Try to find the measurements that result in a successful Department of Child Safety. And that is a number of metrics across the board that will say you're moving these children into safe, loving homes more quickly. And then you have the other issues around addiction, opioids, and of course the parents, who we want to respect their rights, but our first mindset's got to be for the children.
I wanted to press you for a minute on this question of the reporting of infants who are born substance exposed, because that seems to divide a lot of medical practitioners and policymakers. Should we be living in, and there are federal statutes regarding this, that there is supposed to be reporting when doctors do know that an infant has been born with drugs in his or her system. But you say, well, we're not trying to we don't want to separate the mother from the baby unnecessarily, and so by having these preventive services in place, we're saying you don't have to choose between getting prenatal care or having the baby in the hospital or keeping your kid. Do you think that people are aware of this, that there is a sense that it's okay to go give birth in a hospital if you're worried that your child is born with substance in their system? Or how do you sort of make that knowledge widely available, I guess?
Well, I wouldn't know, how widely known it is. Right. What we wanted to do is bring some common sense to how do we care for this child, and how do we get inside the mind of a mother that's addicted, and provide these options so that we can understand what the numbers are. Of course, I took an oath to uphold the law, so we're going to follow federal law, and we're going to follow state law, and if state law needs to be changed, we're going to change it, and if we want to advocate that federal law should be changed, we'll come here to make the case as well. But this is the situation we inherited, and we also found that these mothers were not reporting or not coming in for prenatal care, again putting themselves and their babies at risk. The other thing is we did have some people from the behavioral and health community that thought this is a trial worth testing, and I'm a big fan of testing things in pilot programs and seeing what the results are. Like I said, we've seen over 90% of the people that have gone into this SENSE program have not had a DCS visit 6 months post achieving sobriety. So to me, that's a successful pilot and something we want to expand. And it does bring a lot of common sense, because I think it's easy to say, let's just take the baby away, or let's have this as the line in the sand. But we're dealing with people, we're dealing with pregnant mothers, and what we'd like to find ideally is sobriety for the mother and safety for the child. And we've been able to have a lot of success stories around that in Arizona, but there were a lot of mistakes and trials that didn't work with that kind of success before that. So that idea of new ideas, and there's things like this going on all over the country in different places in public policy, and I'm a big fan of trying to challenge my team to read the journals, to see other best practices when we go to the governor's conferences, to find out what's working in other states, to have relationships, staff to staff, on what's happening. And we used to call it Procter & Gamble search and reapply, and it's just best practices with attribution and giving credit to the state or the governor or the agency of what they're doing it, and reapply it in the state of Arizona.
Just one last question for you. So, as you said, when you took over, there was a severe crisis in child welfare. There was a lawsuit alleging that there's a severe shortage of physical, mental, and behavioral services available to children in state foster care. And that the state had failed to conduct timely investigations of that maltreatment. Aside from the increase in the number of caseworkers and the lowering of the caseload, are there other things about your approach that you think are replicable in other states? Because a lot of states, frankly, are facing the same kind of crisis. There are some that are under court orders in terms of their records for child abuse and investigations. And I was just wondering if you have any thoughts about what ideas of yours you think might be spread elsewhere.
Well, I would say yes. I think everything that we're doing in the state of Arizona is replicable in other states. The first thing I would say is we've got someone who is really committed and passionate about what is going on in child safety, and Director of Child Safety agency leader Greg McKay. And there's no substitute for leadership. I think he's taken the good people at CPS and he's got them mission driven and focused on this. They've bought into the metrics of what is going to make a successful child welfare agency. There's a video that they put together, and it was done in-house with the social service workers from the agency. It's a Hollywood style quality video, and one of the lead directors inside the agency is someone that is a product of the child safety system, and she stars in the video. It's something that we'll get you the link, and hopefully you can pass around. But I went to visit this agency, and the enthusiasm and passion in the auditorium for the good work that they're doing, and also the recognition. So everything we're doing is public. It's part of the public record. It's on the governor's website. But it is going in and figuring out what the issues are, and the issues are different state to state. Hopefully other states don't have a 27-minute wait list when someone calls the agency because people drop off, but that was a sticky problem that we had to solve. A 16,000 child backlist that's something I hope no other state has, but to clear that backlog completely, we can show all the best practices. There's another thing. There's a book, Government That Works, by John Bernard. I read it when I became governor. There were a number of books I used when I was building Cold Stone Creamery, like The Effective Executive by Peter Drucker, or Built to Last by Jim Collins. Government That Works is something that every agency director in our government has read, and something I'd encourage every governor to read. There's all kinds of best practices, from Martin O'Malley in Maryland to Rick Snyder in Michigan. And we reapplied a lot of those and have worked very closely with John Bernard in not only fixing our Department of Child Safety, but across the board. I'm proud of the agency work that's happening in Arizona. I think it's important that we have a government that works inside our state. And the great thing about being a governor is you are the chief executive. You get to choose the leaders of these agencies and hold them accountable for the direction. And they've bought in. I give them a lot of credit.
Great, thank you. We would now like to open it up to audience questions. I think there's a microphone someone who will come around, so if you raise your hand. Yes, just wait 1 second and we'll get the microphone over.
Hello. I heard you talk a lot about...
I'm sorry, if you don't mind identifying yourself first.
Okay, I'm sorry. My name is Courtney Jones, and I'm interning under the Senate Finance Committee. And earlier I heard you talk a lot about the faith-based community, foster parents and adoptive parents. But I was wondering, what is your state's approach to utilizing kinship family during this opioid epidemic?
Thanks, Courtney. What we wanted to do is make it as easy for kinship families. We do think it is ideal in most situations if you can keep a child within the family. I mean, think of a child going to a grandparent. We prioritize, parent first, then grandparent, then kinship. But we also wanted to have that foster parent in the mix as well. So we provided dollars that would be available to foster parents that would be available for kinship. Because sometimes, an uncle or an aunt are struggling financially. So why would they say, we'd like to take the child, but we can't because we can't afford it, yet the state's going to go pay for someone the child doesn't even know? So we wanted those dollars. I think somehow those were lost from the comments that I intended to say and the prepared comments that I had on the podium. That is something that we've done in Arizona, that we're going to prioritize parents first, then grandparents, then kinship, but we're going to recognize a foster parent equal to kinship if a kinship individual isn't available for 9 months. Why would we take someone that's in a loving foster home that wants to keep that kid to move them to a family member who they've never met and hasn't been available for 9 months? So I would say that's another policy that would maybe make both sides upset, but would solve the situation for the child, and it's a real solution.
I have a question right here up front.
Thank you so much for your comments and for your work to protect families and children. My name is Lauren. I work for the Ethics and Religious Liberty Commission for Dr. Russell Moore. I specifically want to ask about the faith-based work that you see in your state. So what encourages you about the way that pastors are specifically engaging on this, and where would you like to see faith communities engage more, and how can they specifically work well with the government to support your efforts in Arizona?
Well, I think first is just having a relationship with the faith-based community, and there's a number of things that are good about being the governor, but the one power that you do have is the power to convene. So when you ask people to come visit you on the 9th floor, you can bring them together and you can talk about these issues and you can present the facts and you can ask for help. And I would encourage every governor to do this. And the faith-based community has a number of issues that are important to them, and those issues are important to me as well. But this is a very pressing issue in every state, and it's one that requires action right now. And when you can expand yourself or exponentially become a force multiplier with people on Sundays saying in their congregation what the situation is inside the state and what they're called to do, you get a lot of people that are joining the foster care system, joining the court-appointed special advocate, world. And then people to find their roles. So when I say faith-based community, it's one way of being specific around community, about the volunteer organizations and associations outside of government that actually make a state and a communities work. But I do think the faith-based community in Arizona has been especially responsive in helping fix this, and I think that exists in all 50 of our states.
I think we could take one more question in the back. Oh, sorry, the man in the back. Sorry, go ahead. The man in the back. Sorry.
Chris Renner. I'm a foster parent.
Thank you, Chris.
One of the things that we have, I live in Fairfax County, and in Fairfax and Loudoun counties around here, they're really affluent areas. You have a lot of parents who are in a good position to be able to help as foster parents. The needs for where the children are is not usually the same place. They're in counties in, say, Southwest Virginia or in other states. Is that something you've encountered in Arizona? Geographical disparity between where the resource families are and where the kids' needs is?
I think that would exist in Arizona, or it did exist. First, I want to say thank you very much for being a foster parent. There's no substitute. You're making a dramatic difference in children's lives. And I've seen in my own extended family, my sister-in-law adopted a child out of foster care, and my wife Angela and I stood as godparents to Adam two Easters ago. And he's changed our family's life and their family's life. But I saw how the system almost frustrated them out of adopting. It was very challenging, and this was a two-parent family of means that had 2 children already and wanted to adopt a child out of foster care. And they were almost frustrated out of not being able to do it just by the delays and way the system worked. I'd like to say that we have fixed all that, but I think we've cleared much of the obstacles. What she said to me is that Catholic Social Services was terrific to work with. The CASA organization was terrific to work with. And it was the Attorney General and the state legal forces that almost had her say, I give. I'm not going to try anymore. So I think this idea that we want to get oftentimes what you say about what's going on in foster care is going to be more impactful than what the governor says or what the director of child safety services says. And this is why parents and the faith-based community and people talking about this, because as a foster parent, you can do this for a period of time. Of course, it's a different commitment to make the decision to adopt a child, but we have a economy that's doing very well. We've got a lot of families that are out there, and this is something that if we do get volunteer organizations and individuals involved in, we can make a tremendous difference inside these states. It's really that these agencies have options depending on the situation, and the worst options, of course, are a child that is living inside a state agency, or almost as bad are these group homes or congregate care. You want to find loving foster homes or adoptive homes, and ideally, if you can find sobriety for the mother, that's an even happier ending. But there are solutions there. There are people that can help. I think this is something that's almost been a somewhat invisible problem, and we've just tried to bring light and exposure to it along with solutions and get people involved.
Thank you. Do we have time for one? No, I'm sorry. We don't have time for any more questions, but thank you. We're going to take a brief break while we rearrange the stage and bring up our panelists. But I'd like you to help me thank the governor again for joining us today. It's been great.
Thank you, Naomi. Thanks.
Ladies and gentlemen, if you wouldn't mind taking your seats, we're going to start the second half of our program. Just want to introduce our panelists today. So thank you again for coming out to discuss this issue this morning. I want to turn things over our great panel of experts. I'm so pleased. A lot of them agreed to do this at the last minute, and I'm thrilled that we were able to assemble such a great group. So the first person I want to introduce is my colleague here at AEI, Sally Sattel. I'm sure many of you know her byline. She's a practicing psychiatrist and lecturer at Yale University School of Medicine. She examines mental health policy as well as political trends in medicine. Her publications include PCMD, How Political Correctness is Corrupting Medicine, and Brainwashed, The Seductive Appeal of Mindless Neuroscience. Our second panelist here is Elizabeth Bartolet. She is the Morris Wasserstein Public Interest Professor of Law and the Faculty Director of Child Advocacy Program, which she founded in 2004. She teaches civil rights, family law, specializing in child welfare, adoption, and reproductive technology. And before joining the Harvard faculty, she was engaged in civil rights and public interest work with the NAACP Legal Defense Fund. Brandon Logan is the director of Center for Families and Children at the Texas Public Policy Foundation. Before joining that, he represented hundreds of children as an attorney and guardian in child welfare courts throughout Texas. He has also represented parents, grandparents, and foster families in custody and adoption cases throughout the state. And then Robin Gertner. He is the director of the Division of Data and Technical Analysis for Human Services Policies at the Office of the Assistant Secretary for Planning and Evaluation, and the U.S. Department of Health in the U.S. Department of Health and Human Services. Robin directs a portfolio of research taking advantage of quantitative and qualitative analysis to address critical human services policy questions, and he is one of the people responsible for that statistic that I offered you at the beginning about the incidence of opioid overdoses and the increase in foster care. So with that, I'm going to sit down, and we're going to ask each one of them to offer some brief remarks before we have a discussion and some audience Q&A. So I think we are going to start with my colleague Sally to tell you a little bit about the background on the opioid issue.
Hi, thanks, Naomi. I actually found the governor's talk very inspirational and liked his sense policy very much. So I'm just going to set a little stage here for really the policy commentary to follow. So in some ways, what I'm going to talk about is sort of the best case scenario, considering you have a woman who is using drugs. So when I started my career in psychiatry, it was in the actually mid to late 80s, and that's when crack cocaine was very big and becoming bigger. And there was, as you know, considerable panic about crack babies. And, it turned out the bottom line is by no means is this a healthy development to be using crack and exposing a fetus to that substance. But, the near hysteria that there would be legions of brain damaged, children marching through ghettos, that just didn't happen. And it turned out, yes, there may be some, compromise. It's obviously a risk. There's a risk of bleeding and preterm problems with cocaine. But in terms of general IQ and development, neurological development, there really weren't gross deficits in these children. And to the extent that they had problems, it wasn't so much that they were born to a woman who was using cocaine. It's that they had to go home with the woman who was using cocaine. And that's really the main issue when it comes to almost any substance. But I would argue, and just in terms of actual toxicity during fetal development, alcohol is apparently worse, poses more of a risk than cocaine, which may be counterintuitive, but that's one of the things we learned. And we did learn a lot. And so I can't emphasize that enough. It's the environment in which the child goes home to. And that's what also makes some of this research, this follow-up research on the effect of of prenatal exposure so complicated is because you have to control for the fact that there may not have been good prenatal care to begin with, poor nutrition to begin with, but in terms of any kind of problems at birth that you might find. But then, of course, when the child goes home, it's a chaotic environment. He may not be cared for well, taken to his pediatric appointments. There's violence in the home, enormous stress, neglect. I mean, you can go on and on and on. So that's probably my big take-home message is it's, again, what happens in a sense of the child, once the child is born, what happens afterwards. And I loved the governor's description of the sense policy, which was sort of an effort to almost envelop, the woman after she leaves with services. But let me be very brief here and just go back a little bit and break the situation into sort of three phases, the prenatal, the perinatal, and the postnatal. Very quickly, obviously, as I alluded to, using substances while you're pregnant is terrible. You don't keep up with your appointments. You can expose yourself and a child to all kinds of long-term disease, HIV, and I don't think hepatitis C is transmissible. I don't know about that, actually. But certainly children can be born with HIV. We can prevent that now, but that is a risk. But the main risk is infection, and that's much more acute. If a woman turns to prostitution, you can imagine the sexually transmitted diseases she opens herself up to, and the domestic or physical violence. So all these are obviously very, very highly menacing situations that prevention could certainly help, and that's the time to intervene. There are lots of screening instruments that OBGYNs can do to change to gauge the extent of addiction. Urine screens are important because it's not only the drug that a woman may even tell you she's using, opioids or cocaine. It's additional drugs like gabapentin, which people now abuse quite a bit on the street, benzodiazepines like Valium, and even nicotine that actually can make neonatal abstinence syndrome worse. During prenatal time, you want to get someone on treatment as quickly as you can, and the typical treatments for opioid abuse of methadone, buprenorphine, these are opioids themselves, or a different drug called naltrexone, which is a blocker, but a person has to be detoxed before they can start that. That may be a question, but it's okay to be on these medications as long as the doctors know ahead of time. Well, they prescribed it, but the point is there's time to prepare for the neonatal abstinence syndrome, in other words, the withdrawal of the infant, which will likely happen if a woman is maintained on these medications, but if the medical system is prepared for that, then they can detox the child with morphine or methadone or buprenorphine. And there are protocols for this, and it's happening as we speak in many thousands of neonatal care units. Obviously, a woman should be in counseling. There's a lot of preparation to be done. Now, therapeutically, in a way, this is kind of an ideal situation. And as I said, I am talking about sort of the optimal situation, but because you have a very discrete therapeutic goal here, which is having as healthy a baby as possible and creating an environment in which it's safe to raise. And that's organizing for the patient and the therapist, and the woman usually wants that too. So you're both working towards the same goal, and that's a very, very constructive thing. And as a clinician, it's something that's very welcome, because a lot of times people are very ambivalent about giving up drugs, but here there is such a concrete reason to do it, and also something a lot of women are excited about, because they've had, you can imagine how much difficulty they've had all along, and this symbolically and realistically represents a chance for a new life. So I'm going to stop now because I have a lot more to say, but the basic points are that you want to work as much as you can with these women in a collaborative way, to the extent that they think being detected with drugs is going to lead to a punitive outcome. that might deter some folks from coming in. But to the extent that it leads to a therapeutic kind of embrace, that's something that a lot of them probably will want to pursue, and all that help they get afterwards, how they're going to deal with the father. Maybe they should get rid of the father. Sometimes these relationships are so toxic. It's something to consider. But these are all complicated problems that need a lot of time and a lot of attention, a lot of good social work, a lot of quality social work. And so much of the problem, and I see this every day in my work, is that, frankly, so much of the care is lousy. We send people to a psychiatrist, and they see them every 3 months for 15 minutes. That's absurd. And I'm not even talking about someone who has now the stress of a baby and taking it home with other kids, needs all kinds of support. So I think that involving the criminal justice system or ideally more protective services first in a civil capacity is all very reasonable, but as long as it's so clear to the woman that it's done in a therapeutic spirit and not a punitive one.
Thank you. Robin?
Great, thank you. Thanks for the invitation. It's really a pleasure to be here. I'm going to talk about a few of the key findings from the research that we've finished conducting and some of the work that we're continuing at the Department of Health and Human Services. And then I want to talk just real briefly about some of the opportunities, because we talk so much about things are really bad, there's not a lot of hope, what are we going to do? But I think that there's a lot of opportunities that are out there, so I want to just bring up a couple of those. As Naomi mentioned, one of the key findings that we found was that across the country, a 10% increase in overdose deaths is going to predict a nearly 4.5% increase in foster care caseloads, which is pretty dramatic. And it's even worse in specific places, which we hear about in the news media all the time, or if you're from one of these states or communities, you know this. West Virginia, other parts of Appalachia, parts of New England, Michigan, parts of the Pacific Northwest have really experienced this. One of the big parts, the big challenges that we found when we went to 11 communities and spoke with nearly 200 individuals is around treatment. The challenges of accessing medication-assisted treatment, which is the kind of standard of care for individuals with opioid use disorder. There's a tremendous lack of treatment, quality treatment, as Sally mentioned. There's a difference between treatment and then quality treatment, and there's a lack of this in a lot of the communities that are hardest hit. But it's not only if treatment's there, it's linking parents in the child welfare system or involved in the child welfare system, linking them to the treatment and the right kind of treatment. So you'll see shortages of maybe there isn't a physician that can prescribe buprenorphine, or maybe there is, but most of these individuals need way more than just buprenorphine. They need way more. They need psychosocial supports. They need social supports. They need housing supports. They need employment supports. And if this isn't in place, we find that it's really hard to find successful reunification outcomes for children with their families. Perspectives in the same community on treatment diverge. And so what you'll see happen is you may find caseworkers that are very supportive of a mother getting medication-assisted treatment. But then when they go to the judge may say, oh, no, there's no way this is going to happen with treatment. With this treatment, you have to be completely off, which is a little ridiculous, because we would never think of taking someone with chronic diabetes, we would never think of taking them off of insulin after a short period of time. And these are chronic conditions. And then beyond that, the whole chain of understanding in many communities isn't aligned. We saw a lot of failures of collaboration across silos, within a community and then across states even. Treatment systems in a lot of communities are misaligned with child welfare systems, misaligned with courts, misaligned with public health, and simply areas that had lack of communication across these systems were facing the most challenging circumstances. And where all these systems can align, where public health can speak and work closely with the child welfare system, where the child welfare system and the family courts are working closely together, where treatment can be kind of pulled in, then we see much better success. And I'm just going to briefly talk about some opportunities, because it's not all bad. I think that I'll just mention 3 of the kind of the big opportunities I see, and I'm sure we'll talk more about this in the discussion. One is there's more money than ever. And Naomi, you asked the governor the question, is money the problem? And well, money's always the problem, right? We always want more money, and we'll always take more money. But there's more money now appropriated through the recent budget appropriations bill. Before that, with the 21st Century Cures bill, there's more money than ever. And there's likely to continue to be money. It's either spent by the federal government or by states or local communities or foundations or the faith-based community. So there is the resources there. It's figuring out how to take those resources and implement those through strategies, through approaches that are likely to be successful. And when we think about the child welfare system and the safety of children and stability of families, figuring out how to take the treatment resources that are out there and implement those in a way that can have those downstream benefits of not just getting treatment to this person, but also supporting the entire family, supporting the children. So I think that there's a lot of possibilities there. I think the level of awareness is way better than what we would have seen in past drug crises. Everyone kind of knows what the problems are now. It isn't that you see one aspect of a system. The treatment community is really up to date and woke about the issues. You have courts and judges that are understanding what's happening. You have the public health system. You have law enforcement. I was recently at the National Sheriff's Association, and what you heard coming out of the mouths of sheriffs is what you would have heard from treatment, what you would hear from hospital workers, and that's incredibly positive and makes me optimistic that people understand and are willing to work together on the same page. And the last thing I just want to mention is that there are promising and evidence-based interventions in this space. There is great work. The governor mentioned that there's great work going on in a lot of states, and I think looking across communities, looking for those practices, looking for those evidence-based practices, we see very promising interventions in Kentucky. We are seeing really great changes in Tennessee, in Ohio. Those are just a few states, but a lot of states are doing really great work. And I think as more evidence builds on how effective they can be, I think that's going to really be a sea change for this issue.
Brandon?
Thanks, Naomi. And I want to thank each of y'all for being here. You're taking time out of your lives, and I assume that this is an area that's important to you. It's important to me, and I know of no more complicated, perplexing, emotionally charged, politically dicey issue than child welfare work. And it is a perennial issue for state legislatures. It's a perennial issue for DC, and the policy work in the area has been related to looking for a panacea, like we want a quick fix to the issue of addressing fragile families, and there's just not one. We've looked toward family reunification. We've looked toward adoption. We found all of these panaceas, and we're at a space where it's just complex. It's complicated, and we need an all-hands-on-deck approach. In Texas is pretty much where Arizona was in 2012. We heard the success from Governor Ducey, and what Governor Ducey and Director McKay have been able to do is reduce the number of children in care, increase the capacity, and reduce caseloads. And that's not related to anything other than a focus on family preservation, family reunification. Adoption has to be an alternative, but it's the last alternative. We can't lead with adoption. Leading with adoption hasn't worked. Leading with adoption is a myth that at some point people will rise up to come adopt these children, and it's never happened. In fact, we've made dramatic attempts in Texas to increase the number of foster homes and adoptive homes, and we've since 2012 we've increased those by 2,000. During that same period of time, we've taken in 4,000 children. Arizona did the same thing. Arizona made dramatic attempts to recruit adoptive families, and we need families to adopt. And since 2012, they've increased their capacity in the foster care system for strangers who want to adopt a child by 350. At the same time, they've taken and put into care an additional 3,500 children. So the answer is what Governor Ducey talked about today, which is working on the front end, keeping children with their families, and providing wraparound services. That solves the problem not only for today, but it solves the problem going forward. It keeps children out of the criminal justice system. It keeps children out of the juvenile justice system. Children are actually less likely to be abused or neglected outside of foster care than they are inside foster care. Children are more likely, in Texas, they're 19 times more likely to die of abuse or neglect in foster care than out of foster care. So the myth that foster care and adoption is somehow the safe alternative and that everything else is risky, that's a myth. We're talking about balancing risk. There's risk in the system, there's risk outside the system. We've just really gone through this issue of, is adoption safe? Recently in Texas, in the last 6 months, we had 6 children that were adopted out of Texas, driven off a cliff in California by their mothers. In the Hart case, in the last 6 months, we've had an adoptive 3-year-old killed by her adoptive parents. And so there's no panacea here. We're dealing with imperfect people all around. And so my comments would be really what Governor Ducey said, which our focus on giving services to families, especially to pregnant women, not doing anything that would run pregnant women away from prenatal care. I've seen that in my work. Before my career in policy, I represented women, and I represented mothers and children in the child welfare system. I've had to make the recommendation to a court to terminate a parent's rights. And I've gotten to celebrate whenever we were able to reunify a family. And I'll tell you that of those two, seeing redemption, it was worth everything it took to get there. So I don't think that we give parents enough opportunity. I think we should expand the opportunities for parents to get their kids back. I think we should have a redemption-based system and not a punitive system, not a system that rushes to terminate parents, but a system that gives parents all the opportunities that we can, because we know, and the science tells us, that it is safer and it is better long-term to be with your parent, your biological parent, than any other opportunity. There's this persistent adoption difference. AEI scholar Brad Wilcox just issued a report on this. There's this uncomfortable adoption difference even between matched pairs. An adoptive family and a biological family, there's a difference in their education, their academic success, their behavior going forward. So adoption is an option. Adoption has to be an option, but adoption is a last resort.
Okay. Betsy?
So I'm really pleased to be here. I think there's a lot of agreement on the panel. I'll just say from the beginning that I differ with a lot of the factual claims made by the most recent speaker. So you'll hear that in what I have to say. I want first to really applaud Governor Ducey and the Arizona legislature for what I've focused on in preparing for this, which is the child welfare legislation. I think it's a huge step forward in a child-friendly direction, and I think that is because, in fact, it moves in the direction of more state intervention, more removal to foster care, and more adoption. So I'll be a little more specific about that later. I think this is important, this legislation, for, well, lots of reasons, but two primarily I want to talk about. First, that the drug crisis. Now, it's in many ways the drug crisis has been going on for decades. It's just more extreme today. So the intersection between abuse and neglect and illegal drug as well as legal alcohol abuse is almost total. 70 to 90% of the parents in foster care are parents with a significant drug and or alcohol abuse problems. So drugs are huge. They're just more huge today. Second reason I think what Arizona is doing is so important is that we need state leadership, in part because I think that the federal leadership as exemplified, not this man's federal leadership, but federal leadership as exemplified by the recent very important Family First legislation that Congress just passed, I think moves in exactly the wrong direction. So we need states to be stepping up. So briefly in terms of the briefly in terms of the child-friendly, which I think is very different from, quote, family-friendly, the child-family-friendly features of the Arizona legislation. It pushes for early intervention, especially for infants. This is huge. We know from the science increasingly over recent decades, the science is crystal clear, that early abuse and early neglect, just as damaging as early abuse of children, has lifelong implications. We need to intervene early. We need, as you indicated in your comments, if you put infants who are illegal drug affected at birth into nurturing homes at birth, they will do fine. Alcohol, not so much. But early nurturing is central. We need permanency because early nurturing and then bouncing kids around isn't helpful. So the goal in this legislation is to place infants in permanent homes within a year. That's good. Better if they can be placed earlier than that. We need intervention, I believe, in the form that Arizona legislation gives us now. Removal to foster care when it's needed to protect children and expedited termination of parental rights in egregious cases. Part of what's really important about this Arizona legislation is that it requires expedited termination of parental rights in aggravating circumstances cases, and it defines kids affected by drug use as fitting those aggravated circumstances. So if you have a child affected by parental substance abuse, and if you have evidence that that parent is not likely in the immediate/near future to be able to get off drugs and be a nurturing parent, then this Arizona legislation requires termination of parental rights. That's huge. It's authorized by the federal Adoption and Safe Families legislation of 1997, but almost no states have moved to take advantage of the opportunity to do expedited termination. So, what this means is if a child is born drug affected and the parent's not likely to get off drugs, that child can be placed instantly in a foster adopt family and have nurturing care from day one effectively. Obviously, it would be 2 to 3 years before termination of parental rights would happen, but that child doesn't have to experience disruption. So very briefly on the federal family, it's called Family First Prevention Services Act is the federal act. And I want to say, first of all, it's called family. It actually is parent-friendly, not child-friendly. So this is the typical euphemism of the extreme family preservation movement folk, which is call it family when really it's a parent rights, parent power act. It talks about prevention. It's not a prevention of child abuse and neglect act. It's a prevention of foster care. So it moves in the direction of preventing kids from being put into foster care, which our last speaker thought was a good thing. Very briefly on what I think are the right statistics on that, I think foster care clearly operates in general to protect kids against abuse and neglect. It operates better if we don't lock them into foster care for 5 years, but move them either back to a nurturing home or onto a nurturing home. Less than 1% of the kids nationally in foster care are abused and neglected. Less than 1%. If you look at the kids who are kept in the family, as this federal act encourages, despite evidence that they have been repeatedly abused and neglected, but kept in the family or removed to foster care and sent back home, the statistics are that between half and 2/3 of those kids will be re-abused and neglected. So half to 2/3 compared to less than 1%. I would say it's clear that foster care is protective. Whereas this new federal Family First Act encourages it, basically is designed, but it's promoted by the Casey Family Services Foundation, which is committed to eliminating foster care and to extreme family preservation programs. And yes, this is an act that implements the Casey's vision. Now, of course, I, with everyone else in the world, believe in family preservation. We should do everything we can to keep kids at home. We should help the drug-addicted, alcohol-addicted parents if they are willing to work from the moment of birth to get off those substances. But this Family First Act is designed to prevent foster care, to provide services to parents, rehabilitative services, only after they've been identified for serious abuse and neglect that's so serious the system's ready to remove them to foster care. So I think it's a real problem, and again, I'll just come back to the fact that that's why it's so important that Arizona, and I hope other states, will move in the direction of truly child-family policies.
I just wanted to ask maybe one question of our panelists, because we're going to open it up to questions from all of you in a minute. But I think maybe one question that might get at sort of maybe some central disagreements here is the question of what are the possibilities for these preventive services? I mean, Robin, you mentioned that there's promise here, but one statistic I read, there's a clearinghouse in California that looks at some of these evidence-based programs, and less than 10% of them seem to actually have evidence that they work. So, and we know, Sally can talk about sort of the record of substance abuse treatment, just how likely it is to succeed in the long term. So I wonder if each of you might address this question of prevention services when we look at it, give it a cold hard look. What are its chances for success given what we know now? I don't know if Robin or Brandon, you want to start, or?
Yeah, no, I can do that. So I would submit that we've not actually tried prevention and family preservation, that we've not coordinated services for parents in the way that we're talking about doing under Family First, and that Governor Ducey laid out today, that these services have existed in silos, and these families will have touched all of these different systems, but those systems aren't talking to one another. There's plenty of money in the system. It's not only in the child welfare system, but it's also in workforce solution systems. It's in the Medicaid system. It's in TANF. There's all of these systems that these families tend to engage with, yet there's no one really coordinating those services. So something we did in Texas, which is a big state, and the problem we were having is breaking up family preservation services in Austin, trying to manage all of the families that were trying to be served throughout the state. It was just impossible. And families weren't getting served. They were basically getting no services during this family preservation stage of service. And so we started a pilot that would break that up, put a lead regional nonprofit in charge of the family preservation work within a community. What that will do is allow that nonprofit to engage with community resources that already exist, with religious resources that already exist. The agency's never really taken advantage of all of the resources in the community that could help a parent. All they've done is, and not with great success, provide their contracted services. So what we need to create around these families is wraparound services, a circle of support, and a social network. That's the people that I call whenever I have problems, right, with my 5 kids, is my mom and my mother-in-law. My clients didn't have these people, and we need to get people that they can trust and that they can call in their lives. And moving toward these punitive and hostile and anti-parent policies don't do that. All they'll do is send parents underground.
So, Robin, can we provide government-funded mother-in-laws?
My mother-in-law is great. I would love to share her, but I have 3 kids. I'm impressed he's got 5. Well, I think that generally we would put out the call that we do need more evidence of program effectiveness. I think there is a lot of research on how to reduce the risk of overdose, of relapse, increase retention, treatment retention, and increase chances of recovery from opioid use disorder through medication-assisted treatment. But what we don't know is how that aligns with child welfare outcomes. And I think that is a critical area where we need to understand better as child welfare agencies start to look for interventions that will be successful. There has been proven success with a couple models. Family treatment drug courts have generally been seen as very successful. And one of the great things that they get to do is get people in treatment early. And then you can find out quickly, is this going to work or not, as opposed to waiting and waiting and waiting and waiting, where the child is going to be in an impermanent situation for a long time. A family treatment drug court can make those decisions early, can give the mother, in most cases it's the mom, the opportunity to recover, the opportunity to enter treatment early. Peer recovery supports have been successful when paired with things like medication-assisted treatment. Some of the most promising and evidence-based approaches in child welfare utilize those approaches. So I think we know more than we ever have about what's successful, but we need to know a lot more, and we need to be not only investing in resources in implementing this stuff, but in understanding what is going to be successful.
So I'm assuming you're going to lie. The only program where there's good social science indicating it's successful in this child welfare space is early home visitation by nurse practitioners. Okay, so these programs are designed to reach pregnant women during pregnancy, advise them during pregnancy to get off of drugs, alcohol, and tobacco, and then at birth to start visiting in the home on a very frequent basis, every couple of weeks in the beginning, provide parental training. It's reaching people before they have its first pregnancy, reaching people before they've ever committed abuse and neglect, when they're most highly motivated to be loving mothers. And there's a good success rate. It's a voluntary program, so it's a good success rate with the people willing to stay in the program, and only a third to a half stay in the program. But that works. I'm a complete believer. I'll just talk about the drug treatment for a moment. I mean, I started a public interest law firm focused on ex-addicts and treatment, and I'm going up for a board meeting this afternoon. It's been in existence for about 45 years now. I totally believe in drug treatment, providing better access, enabling addicts to get their lives together. But it is not easy, and the success statistics are not good. So I'm a total believer in what you just mentioned, the family drug court model, and I'm a believer in it for 2 reasons. One is it makes a promise to the parent, and it makes a promise to the child. So these are the 2 reasons. The promise to the parent is we will give you early access to treatment. You won't be sitting on a waiting line. We give you access right now. And if you stay in treatment, we might remove the child to foster care or not, depending on the current risks. But if you stay in treatment, you will be a parent to this child. If you stay in treatment, get off drugs, get your life together. The promise to the child is, if that doesn't happen within a year, you, the child, move on to a nurturing family. But also, if there wasn't promise earlier, child removed to foster care pending seeing what's happening to the parent, and the child ideally moved to the foster-adopt family so that they might get early permanent nurturing from the get-go. So I want to help those parents. Likelihood they'll be a good parent within a year is fairly low, but at least we're monitoring the situation in the family drug court, heavily monitoring. These parents are being tested for drugs. Are they staying with the regimen or not? And if they're not able to function as parents, that child is protected.
I agree with that wholeheartedly. What the two of you just said, we have to take great advantage of any leverage we have. So that's one. Two out of my three things is very practical. If a woman has to go to residential care, make sure there's accommodation if possible for the children. Even if she's going to an outpatient clinic, having daycare in the clinic is really, I mean, these are, there's every excuse not to come. And there's also a way to turn that into incentive. And speaking of incentives, there is a huge role for concrete incentives, which this is one of my big soapbox issues. We do not use these enough. There is a huge literature on contingency management. And even with pregnant women, just one model, for example, if they, this is from Johns Hopkins, if the women, complete within, the week, let's say, you give a clean urine, go to their meetings, do whatever's expected of them, they get to go to this room that's in the clinic that has all kinds of toys and things that kids would use, clothes and all the things that they would need to start preparing, for having the baby. And it's an immediate reward. And that kind of incentivization with, swift and certain, you want to respond when someone does something good. And those kinds of incentives can be extremely effective. And we don't use them enough. And I really think that they would leverage, treatment success isn't so good, but treatment quality isn't so great either. A combination of these medications that stabilize people, plus incentives, plus, again, ideally, a concern that, we're watching you, but we're watching, with the expectation and hope that, you're able to do this. And if not, then they're...
Can I just make a comment on the family drug courts and how that, because they do that incentive thing. These judges get off the bench, they give people hugs. There are certificates of success as you're moving down the line. The audience is cheering these women on when they're making it, just to underline your point.
I think that should happen a lot more.
Thank you. Go ahead, just wait for the microphone. If you just wait for the microphone. I know you're impatient, but...
But you guys, by being here, if 6 billion in the world...
Could you identify yourself? Just tell us your name.
Yes, thank you so much. If there are 6 billion in the world, you guys are representing 5.5 billion, and you guys are really doing a great service. But at the same time, I'm so impatient. And my name is Doma, and I'm from India. I did teach in the high school, and then I did get the opportunity to immigrate here in 1992. So blah, blah, blah. And now my last job was in Radio Free Asia in broadcasting in my Tibetan language. So that was kind of challenging. I know it's not challenging, but there's a lot to learn about my own language and culture and all that. So this item, I never attend, in the think tanks, just because we are in the most affluent country in the world and we are struggling with this sort of stuff. And I have no patience, just to let you know my kind of percentage of population that are ruminating and that are looking with awe why we are not fixing this when we have so much larger that you and I will never ever be able to solve in this another century. And plus there might be even more that we don't even have access to. So with that, what I want to say is just out of many, I will try to put down in writing in my broken language, English. But other than that, just to break some ice, that we are taking too long in terms of this child abuse, that abuse. So we are political refugees in India. So there are so many youngsters here. So my main goal, before I forget to mention, is these are not married yet. So when you marry, I want to remember about the chipping and all that stuff. And then the kids that are put into couples, into good families, into rich families, into ordinary poor families. We were not that rich.
Sorry, can you ask a question of our panelists? We don't have a lot
so
of time.
This is like a plea and also an idea. And also, are you guys aware of it? And then when you do attack, this sort of very, very kind of, this I would say is a little bit on the higher level, kind of soft problem, that you guys be careful of each other, because there's, I think, different families, different political groups fighting, if I'm not wrong. I'm a very scientific person, so I never ever get excited in political field and all that. But at the same time, just because you're very nice and smart, you get to see a lot of things. And this one, I don't want to be quoted, wherever the camera is.
Okay,
It is off the record.
Yeah,
I
it
want you
sound
to.
like there's a question here. Do you mind if we
So
move
this
on?
is a very important question, my dear.
Right.
Okay. So please, that we need to work on this. Who are the ones that are willing to say yes as a parent? Like say, I never married because that's one of the reason that I go through, and I'm more than 50 years old now. That even in my family, I think we are struggling about that, and we are such nurturing families. Okay. So they put
Thank you very much.
some kids, and that's why the Hollywood, divorces,
Right.
all the.
Okay, we have to move on. So, yeah, if
We have to
Thank
let
you.
other people
Okay.
have a
Yeah.
chance,
Let's
okay?
have-
Other people need a
does
chance.
anyone
to
else
talk.
have a question? Who else
Yes,
has a question? Go ahead.
I would like to. My name is Kathy Conca. I was hoping that you could comment on what might be a middle ground between keeping the child with the birth parent who has a substance use disorder and the other end of the spectrum, which sounds like foster care into adoption. Can you please talk about your thoughts and feelings on a middle ground, which is possibly placing the child with another family member for them to care for or adopt?
Certainly, 50% of our kids in Texas exit the system to relatives. And if it weren't for the involvement of Kinship, the foster care crisis that the states are experiencing would be magnified by 100-fold. So the important thing about the Family First Act is it does allow children who are placed with who are with their parents to be placed with relatives while the parent receives the services, not placed into foster care, but placed with relatives outside the system. There's also programs, again, outside of foster care on the front end that allow other caregivers, unrelated caregivers, to take care of children while the parent gets the help they need, and so they can become safe. And then when the home is safe, to return the child back. So that's the immediate end. And then, of course, moving into foster care, kinship care has grown and is the answer.
Anyone else want to?
Well, I think there are two systems we have now that are somewhat what you're asking for. So one is child is with birth parent but being carefully monitored, as with family drug court, being tested for the drugs, is the child okay? Is abuse and neglect happening or not? Another is child is in foster care, but all foster parents today, unless it's an extreme awful birth family, I'll just say, are encouraged to cooperate with the birth family, to have visits with the birth family. The basic idea of foster care is the first priority is to send child home. So there should be that working with the birth family, but it's, so those are two ideas the current system has.
I'd like to mention something about that because in order to grow capacity in the foster care system, states have moved toward foster to adopt, which is recruiting foster parents by saying, this is an inexpensive way for you to adopt a child. What that does is it sets up this zero-sum game within the foster care system where in order for the foster parent to win, the foster parent who wants to adopt to win, the parent must lose. And in order for the parent to win, the foster to adopt parent must lose. And so deadlines like the one in the Arizona bill that say if the child's been in the home for 9 months, then the foster parents get all these extra rights. It really has them, more than engaging with the parent, it has them marking off X's on a calendar waiting for the time that they can enter in because their primary motivation for entering in the system is not fostering. It's not to work with the parent. It's not to ease transitions for the child. It's to adopt a baby.
Well, I'd just say, and for the child, it means they're in a nurturing home from the get-go, and they would stay there if they get adopted. And I think also post-adopt parents are also encouraged to work with birth families and are selected on the basis of their willingness to cooperate.
I think we can take one more question.
Hello,
I'm sorry, you asked a question before. Do you mind if we go to someone over here? I'm sorry. Thank you. Sorry.
Hi, I'm Amay from the Center on Budget on Policy Priorities. So I'm really interested in, many of you have mentioned early intervention. what about the stigma that's associated with seeking these services? Could you all elaborate on that, please?
Yeah, I can.
You find anything, Rowan?
So there's one of the big challenges that I think has been widely discussed in the treatment community is there's a lot of stigma behind being labeled as an addict or being, having an opioid use disorder or any substance use disorder. And so the stigma is a big barrier to seeking treatment. When we kind of list off all the barriers Sally mentioned, I think you mentioned childcare, transportation, stigma is really high on that list. And I think one of the opportunities that we have is, as I mentioned before, that there's the level of awareness that we have now, I think, is historic, and I think I'm optimistic that we'll get better in that all aspects that an individual seeking treatment will encounter, that stigma is going away. So if it's law enforcement that you first encounter with, if it's EMS that you first encounter with, if it's the hospital that you first encounter with, each of these steps, the parent doesn't feel this stigma that I'm a bad person because I have a use disorder, then they're going to be more encouraged to get treatment. Now, this isn't universal. I think
Sally wanted to add
no,
something.
please. Are you? No,
I thought Betsy was going to.
Yeah, I was just going to say it isn't universal. What we found is communities are very different across the country in their acceptance of treatment as an option, and that there's a possibility, even though success rates are low, that there is that possibility, because you have to give the person hope. Without hope, then there's no way they're going to make it through.
And early home visitation, I'll just say, there are European countries where it is universal. And I do think it would be wonderful in this country if we could have moved to universal where, it's not going to be stigmatizing if everybody has a home visitor in their home from the beginning, and then that could edge into providing expanded services for those most in need.
I'm pretty dubious of universal mandated home visiting. Really, that would be more for surveillance than support, and surveillance is not support.
I was just going to say that this may sound ironic, but some of the harshest condemnation of these people is from other drug users. A pregnant is the lowest on the totem pole in terms of, first you have people who sniff drugs, then you have people who shoot drugs, then you have pregnant women who use drugs, and they are the lowest. And so it's not the treatment system I worry about so much, but you make the system right, as inviting as possible. The idea of peers, women who've been through this and succeeded. It's word of mouth that gets out. Hey, if you end up being reported, something good happens to you. And then the larger question, which we're not going to resolve here, but there's a tension between, of course, the system that wants to be helpful isn't going to. Should be scrubbed of all kinds of judgmentalism in that way or any kind of punitive attitude. But look, this is a cultural issue, and I don't know where we get to a point where we're not disapproving of a woman who's not treating her child right. We can't. So that's just something to. I think we're all working on that. And again, some of the most critical and harsh people are the other folks in the community, let alone the other addicts. So I see the treatment system as a beacon here. Anyway.
Thank you very much. And thank you to our panel. Thanks all for coming.
Thank you.